Everyone, welcome to researchmd.com. We got a great presentation. Today we're going to teach you all about an important vaccination, pneumococcal vaccine, okay? My name is Pramil. Cheriyath. I'm a program director, internal medicine residency, transitional residency. I teach medical students and residents on a regular basis. I'm also a director of research, and I'm an assistant professor of medicine, two major medical schools in the area. So let's look at what is pneumococcal vaccination, right? Pneumococcal infections, you get pneumonia, bacteremia, meningitis are important cause of morbidity and mortality all over the world, especially in the people with immunocompromised conditions, okay? So what does pneumococcal vaccine do? It prevents invasive disease in children and adults. It has studies have shown it decreases incidence of pneumonia. Even the people have pneumonia, the death rate has gone down. So types, there are mainly two types, PPSV23 and PCV13, PCV15, PCV20. So PPSV23 is the polysaccharide component of the vaccine. When you talk about PCV13, PCV15, PCV20, the pneumococcal conjugate vaccine, okay? So the components are, they contain zero words like 1, 2, 3, 4, all the way 23F and 33F. When you talk about pneumococcal polysaccharide vaccine, contains 23 purified capsular polysaccharide antigens, 25 microgram each of antigen per dose, and contains 0.25% phenols as a preservative, okay? Then you have components of the PCV. You got the 13 zero wars from like 1 to 1 and 3, 4, 6, 6B, 7F, and covalently linked to the known toxic protein that's nearly identical to diphtheria known as CRM197, okay? And then you got 0.5 ml of PCV13. What does it contain? Approximately 2.2 micrograms of polysaccharide from each of the 12 serotypes, and approximately 4.4 microgram polysaccharide from the serotype 6B. Total concentration, if you want to know, is 34 micrograms, and the vaccine contains 0.02% polysorbate, 0.125 milligrams of aluminum as an aluminum phosphate adjuvant. Sometimes we need to know what is the component, because you may be allergic to some of the component. That's why we put the into know like what exactly injection, what is inside. Now, PCV, PCV20, and PCV15, which contain 20 to 15 capsular type respectively, were approved by FDA in 2021, okay? PCV is the pneumococcal conjugate vaccine. PCV is widely used for infants and children below 2 years as a polysaccharide vaccine, and it's not immunogenic to them. It's eradicated nasal carriage in children and will decrease the pneumococcal infection in the elderly. So let's look at the recommendation. When do we need to very, very important, right? Advisory Committee of the Immunization Practice, ACIP, recommend this. PCV20 alone you can give, okay? PCV15 followed by 23-valent pneumococcal polysaccharide vaccine after 1 year also. For high and immunocompromised people, you can have a shorter interval of greater like 8 weeks maybe to maximize protection, okay? So you can give PCV20 alone or PCV15 followed by 23-valent pneumococcal polysaccharide, PPSV23 after like 1 year. Now, recommendations again, pneumococcal vaccination is recommended all the adults in the United States greater than 65 years old, okay? Adults less than 65-year-olds who are at the risk of pneumococcal infection or severe complication from pneumococcal infection, you should give. Adults, let's say between 19 to 65-year-olds, they have like this certain chronic conditions. When you talk about chronic heart disease, lung disease, liver disease, and diabetes, give a single dose of PPS23 should be given, okay? For the adults with the higher risk conditions like immunocompromised, asplenia, CSF leaks, cochlear implant, other head or spinal defect that may result in communication with the subarachnoid space, history of invasive pneumococcal disease, give both PCV13 and PPSV23. It's very important to know the recommendations, okay? So mainly if you have to take one thing, pneumococcal vaccine, all the adults 65, greater than 65-year-olds should be getting it. So chronic conditions, what do? You do like single dose of 23-valent pneumococcal polysaccharide vaccine, which is PPSV23 indicated in all the adults aged between 19 to 64 years with the chronic heart conditions, or some of the conditions we kind of make: chronic lung disease, chronic liver disease, chronic renal disease, poorly controlled diabetes, and alcohol abuse disorder. Now, so if you I mean, let's say the patients are developing a risk of developing meningitis. You should also give them cerebrospinal is a CSF leak, history of pneumococcal meningitis, cochlear implantation, prior head injury or head and neck, spinal injury with there is like a resultant cranial defect. You should give history of invasive pneumococcal disease, right? Individuals with history of invasive pneumococcal disease, that means meningitis or bacteremia, you should protect with the vaccine. Impaired splenic function, everybody knows they are immunocompromised. Anatomic asplenia or hyposplenism, okay? And then functional asplenia, sickle cell disease is kind of very common. And single dose of PCV13 followed by PPSV23, like an 8-week kind of give a gap. Repeat vaccination with the PPSV23 at regular intervals important because immunity to PPSV23 wanes with the time. Remember that. Immunity with the PPSV23 wanes with the time, okay? Other immunocompromised conditions are HIV infection, chronic kidney disease, hematological malignancy and generalized malignancy. You got solid organ transplantation, and you got iatrogenic immunosuppression, congenital acquired like B or T cell deficiencies, and all of the phagocytic disorders like chronic granulomatous disease are also important. So when do you revaccinate? Revaccination with the PCV13 is not recommended for any age or risk group, okay? Very important point. If you vaccinate with the PCV13, it's not recommended. Revaccinate at risk individual with the PPSV23 at 5 to 10 year interval. Okay, so if you're revaccinating a risk individual with the PPSV23 5 to 10 year interval, is PCV13 is not recommended any age group. Immunocompromised individuals should get every 5 years, and other chronic condition more than 65 years give for like every 10 years. And dose and route, both the pneumococcal vaccine administered as a 0.5 ml dose, and PCV13 should be given intramuscularly. PPS23 can be given either intramuscularly or subcutaneously, okay? And formulation of the pneumococcal vaccine may be given concomitantly with the other pneumococcal vaccines like zoster, influenza, or separate site with a separate syringes can be done. So adverse effect, injection site is the main common with every vaccine. You got pain, tenderness, swelling, but most of them kind of goes away, right? Some people kind of fever, chills, fatigue, headache, myalgia, and those are most of the symptoms are like self-limited, remember, like every other vaccine. What other one, I mean, I think we need to know, it's very important, which is contraindicated. Vaccination is contraindicated in patients who have a history of severe allergic reaction, anaphylaxis to either pneumococcal vaccine or any of the components we mentioned. So example like diphtheria toxoid pneumococcal conjugate vaccine, if you're allergic to, you cannot take it. Okay, efficacy, I mean all the studies have shown PPSV23 associated with a substantial reduction of both invasive, like 0.2, if you look at the odds ratio, it's like 0.26, 95 confidence, so very strong studies, okay? And PPSV is associated with the reduction in pneumonia in low-income countries, so very, very effective treatment to decrease pneumonia. Pregnant lactating women, this women given before pregnancy, and pneumococcal vaccines appear to be safe when given the second and third trimester. Remember that. Breastfeeding is not a contraindication. Thank you so much for watching. We'll be back with another presentation. Please subscribe to our channel. Thank you.